Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about a worldwide topic, that is menstrual irregularities, which comes under a section called as AUB, that is abnormal uterine bleeding, or it can also be called as DUB, which is dysfunctional uterine bleeding. The term DUB has been replaced with AUB. So we are going to discuss AUB in detail. So why are we discussing AUB in detail today in this video is that many women worldwide are facing with this AUB problems. That can be any sort of period irregularity. It can be scanty periods, it can be prolonged periods, it can be period problem of any sort. All of these come under this AUB. So by discussing it, you will have better knowledge of what you're suffering from and also what sort of investigations you need to do. So let's get into the topic to know more about it. What is AUB? AUB is nothing but abnormal, or it can also be called as dysfunctional uterine bleeding. Is defined as abnormal uterine bleeding that results from ovarian endocrinopathy associated with ovulatory or anovulatory cycle. So what do you mean by this? Any sort of dysfunctional uterine bleeding, that is any sort of uterine bleeding, which can be because of ovulatory cycles, that is release of ovum. It can be because of anovulatory, non-release of ovum. Any of these two conditions, or also because of any other systemic conditions that is causing this menstrual irregularities. All of this come under AUB. Signs and symptoms of AUB. What are the primary signs and symptoms? So remember, if you're suffering from AUB or if you're suffering from any of the menstrual irregularities, there are 4 key points every doctor will look into. What is that? The first thing is cycle regularity. That means if you're having a 25-day cycle, if you're having a 20-day cycle, if you're having a 10-day cycle. So what is the cycle? That is, the cycle means the first day of your period to the next first day of your period. What is the cycle that you're going through? That is important. If it is irregular, it will come under AUB. What is the frequency of the menstruation? As the cycle decreases, the frequency increases. That means if your cycle is every 15 days, so the frequency of menstruating is also more. So depending upon the frequency, if it is regular or too frequent or not too frequent, we will know if you are suffering from AUB or not. And then duration of the menstrual flow. For example, your cycle is every 28 days, but the duration of the period that you are in your menstruation, that is during the menstruation, if the period is prolonged, then that can also be coming under AUB. If it is shortened, that can also come under AUB. Volume of menstrual flow. So the volume of menstrual flow, for example, even if you're suffering from abnormal uterine bleeding and there is spotting, that is very less blood is there, then that will also come under AUB. More amount of blood, even in 2-3 days, that will also come under AUB. And what the other sort of thing that will come under AUB is the passing of large blood clots, that can also come under AUB, and also bleeding between the periods will also come under AUB. What are the other signs and symptoms associated with it? Bloating. Remember, bloating is a common problem. Many people feel bloated. They have like this puffy eyes, puffy face just before menstruation, and it decreases usually after menstruation. So if you're having puffy face or puffy eyes and you're feeling bloated throughout, and then there is breast tenderness, pelvic pain, especially in the lower hypogastric region, extending to the thighs or extending back, or you're having backbone problems while you're menstruating, dizziness or fainting because of prolonged menstruation, weakness because of prolonged menstruation, low blood pressure, elevated heart rate, because if you are bleeding too much, there is less amount of iron, less amount of hemoglobin in your blood, then your heart has to pump a lot of times. That can lead into elevated heart rate. And also pale skin, because there is anemia, you will have this waxy pale appearance of the skin. All of these features, if you're suffering from any of these features, you will come under the AUB criteria. See, many people feel that if they are suffering from any menstrual irregularity, they feel that it can be because of stress, it can be because I'm in the perimenopausal stage, or it can be because I'm in the menopausal stage, or it can be anything. They just feel that it is common. Okay, it is just the bad blood going. See, remember, there is nothing called as bad blood and good blood. It is pure blood. That's it. So if you are bleeding too much, then you have to consult the doctor as soon as possible. What are the severe symptoms of this AUB? Bleeding and soaking of the pad 1 hour after you keep it, or 2 hours after you keep it. So every 1 or 2 hours, if your pad is soaking with blood, you should consider doctor. And then weakness and you're fainting, there is dizziness, and there is low blood pressure associated with pale skin. If you're having any of these features, there's a considered as severe features. Do consult doctor as soon as possible. Next, coming into the investigations part. So what are the investigations that need to be done if you're suffering from any of this period irregularity? The first and foremost, the thing that has to be done is CBC, which is called as complete blood count, or you can also call it as hemogram. So why do you need this CBC? See, remember that if you're having prolonged bleeding, or if you're not bleeding also properly, that can be because of iron deficiency anemia. If your iron deficiency anemia is there, then certain people will face scanty bleeding, and certain people, because of prolonged menstruation, can face iron deficiency anemia. So to know all of this, you should know, have complete blood count picture along with the iron profile to know the total iron binding capacity on all the other stuff about iron. And then why do you need to do a thyroid function test? Remember, thyroid hormone is one hormone that affects the whole of your body, like it affects every part. So any abnormality in the thyroid will result in uterine abnormal bleeding. So do get your thyroid tested if you're having abnormal uterine bleeding. Sometimes it may not be because of the uterus, it might be because of the thyroid also. So there is no structural problem in the uterus. There can be some sort of problem in the thyroid that is causing or making this uterine bleeding abnormal. So do get your thyroid tested. Coagulation panel. Why do you need a coagulation panel? See, remember, coagulation means the ability to clot. People who are having heart disease or certain kinds of diseases, doctors usually prescribe the blood thinners. So if you're using a blood thinner, you might face abnormal uterine bleeding. And also, if you're having hereditary problems with the coagulation, you're having low vitamin K deficiency also, then that can also lead into coagulation problems. So if you're bleeding, like even if you're having cold and you blow your nose, you're having this epistaxis, which is bleeding from the nose. And if you're cut and it's bleeding for a longer period of time, then all of this will come under coagulation problems. So do get it tested if you are having any of these associated symptoms along with abnormal uterine bleeding. Then coming to the imaging test, which is very, very important to know if there is any structural problem in the uterus. First one being the USG, that is ultrasonography of the uterus, to know if there is any fibroid, polyp, or any other structural problems in the uterus. To know it more in detail, you can get an MRI or a sonohysterography done to see the in-depth picture of it. Next, coming into the other investigations, like if after the imaging and after the blood test is done, if you're not sure what sort of a disease it is, you can get a biopsy done, endometrial biopsy, to see what sort of problem, if there is any hyperplasia of the cells, that is, if there is too much multiplication, too much thickness, or if there are any cancer cells, we can know by doing a biopsy. What are the other tests? The other test is called as pap smear. So what is a pap smear? The picture you're seeing here is the pap smear. So why should you get a pap smear done? Remember that the percentage of people suffering from cancers, uterine cancer or cervix cancers, are increasing. So to do get a pap smear done regularly, and also if there is touch while doing a bimanual examination, if you're having any sort of sections of period problems, need bimanual examination. While doing a bimanual examination, even by just touching the cervix, if there is severe bleeding, then that can be because of some cervical cancer. It's not 100% sure, but usually on touch bleeding is because of cervical pathology. So to know that in clear, you need a pap smear done. Then coming into the structure and function, to know any abnormality, why it is occurring, you need to know the structure and function of the uterus or structure and function of the female reproductive system to know in detail where it is going wrong. See, as you can see in the picture, this is the uterus. See, this part is the uterus part. It is called as fundus. This is called as body, and this is a cervical part, and down is the vagina. And you have two ovaries, and then you have two fallopian tubes. So these ovaries produce ovum or the egg, and the fallopian tubes collect it, and the sperm, after being injected, is like swimming through, and there is fertilization here in the fallopian tube, and then it comes and sticks to the endometrial layer here. Okay. So remember that ovaries secrete certain hormones. Even the pituitary gland secretes certain hormones. All of these hormones make the uterus thick or thin. Okay. And the uterus is very susceptible to these female reproductive hormones. Any sort of disturbance in these hormones can lead into different diseases, which can account for abnormal uterine bleeding. Now let's get into the causes and risk factors for this AUB, or the dysfunctional uterine bleeding. As you can see in the picture, the causes can be divided into two types, that is structural causes and non-structural causes. In the structural causes, you can remember if your a medical aspirant, or if you're a doctor and you're like in your second year or first year and you're trying to know different diseases, or if you're suffering from it and you want to remember what sort of pathology is in it, remember that the structural causes can be remembered by a mnemonic PALM. So P stands for polyp, and then A stands for adenomyosis. Polyp is like a tumorous structure. Adenomyosis is the endometrial layer which is getting into the muscle layer of the uterus. Okay, that is called as adenomyosis. And L is called as leiomyoma, which is the other name for fibroid uterus, and also M for malignancy, that is any sort of cancer. These are the structural changes that are occurring in the uterus. What are the non-structural changes? That is coagulopathy. Any sort of coagulation problems can lead in also to abnormal uterine bleeding. Ovulatory, if you have any sort of anovulatory or ovulatory rhythms which are causing this abnormal uterine bleeding. And then we have endometrial. If the endometrial thickness is too much, then that can lead into bulky uterus, leading into abnormal uterine bleeding. Remember that in anovulatory cycles, when there is too much production of the estrogen, that can also trigger too much production or thickness of the, it can increase the thickness of the endometrium. That can also lead into abnormal uterine bleeding. And then iatrogenic. What is iatrogenic? Let's see. Any sort of diseases occurring after the usage of medicines are called as iatrogenic diseases or iatrogenic factors. So why are we discussing? Say, remember that especially in India, many people prefer to prepone or postpone their period for a certain event or for a certain ritual. Okay. So if you're absolutely healthy and after using these hormonal pills to prepone or postpone your menstruation, you have got this AUB, that is abnormal uterine bleeding, and that can be because of iatrogenic factor, that is because of the medicine. And also, if you're using contraceptives from a very young age, or if you're using IUCDs, that is intrauterine contraceptive devices, you can occur or it can cause this abnormal uterine bleeding. You can be absolutely healthy. After using this contraceptive pills or contraceptive devices, there is abnormality occurring, then that is called as iatrogenic occurrence or iatrogenic factors for occurrence of AUB. And also, if you're using any sort of hormonal replacement therapies, or if you're using some psychiatric drugs, these also can trigger a lot of abnormal uterine bleeding. If you're suffering from anxiety, panic attacks, certain medications can trigger abnormal bleeding, or they can cause prolonged bleeding in certain section of people. So all of these abnormal bleeding problems caused due to drugs or caused due to these hormonal pills are called as iatrogenic diseases. There are other systemic diseases that can cause this abnormal bleeding, which is cirrhosis of liver can cause abnormal uterine bleeding, coagulopathy can cause abnormal bleeding, and also, as I told you already, hypothyroidism, mostly than the hypothyroidism, can cause abnormal uterine bleeding. Coagulation disorders, and also, as I already told you, hypothyroidism rather than the hyperthyroidism can lead into abnormal uterine bleeding. Now coming into the body changes part. So what happens inside the body? See, remember, this abnormal uterine bleeding has a lot of pathological lines or pathology in it. So we would not like to discuss that in detail, but I would like to tell you a simple thread or a chain of events that occur. If you're absolutely healthy and you're using any sort of medicines or that is contraceptives or any sort of psychiatric medicines, or if you're using medicines to prepone or postpone your menses, or if you're under stress, or if you're under improper lifestyle, or if you're having a genetic cause, this can trigger the hormonal imbalance or cause hormonal imbalance. This hormonal imbalance can cause polyps in the uterus, it can cause fibroids in the uterus, it can cause endometriosis in the uterus, it can cause adenomyosis in the uterus, it can cause a lot of structural damage to the uterus because of the hormonal imbalance caused by the so said causes. Okay, this hormonal imbalance after causing these diseases or during the starting of these diseases will represent as menstrual irregularities. So many people who come to us, they just ask us first question, will my menstrual irregularity be gone in the first day of treatment or in the first month of treatment? Remember that the menstrual irregularity is because of a certain cause like a fibroid or a polyp or certain other things. So first you have to decrease this. As this starts decreasing, the menstrual irregularity also will start disappearing. It's a cure inside out. Remember that point. Coming to the conventional form of treatment or the allopathic form of treatment or the western form of treatment. So what are the treatment options? The first is hormonal, non-hormonal options and surgical options. Usually they prefer hormonal options. Reason is that if you're having too much of hormonal disruption, they give synthetic hormones to maintain it. What are the non-hormonal options is that if you're having prolonged period, they give certain medications so that which contain tranexamic acid, which stop the menstrual flow. Okay, remember, see, if you're already suffering from hormonal disruption, you're giving again a synthetic hormones, or you're suffering from fibroid issue and there is prolonged bleeding, this medication or this non-hormonal pill will stop the problem, that is stop the bleeding, but the fibroid is still there, it's still growing. You need a medication which targets fibroid. And in allopathic form of treatment, there is no such medication as such. So what do they prefer is the surgical option, that is they either do hysterectomy or they do laparoscopy. Remember that hysterectomy in an early age can cause severity of problems, like it can cause osteoporosis, where your bones become very fragile. If you're starting like doing certain exercises or you just slipped from floor, it can cause hairline fractures, it can cause hot flushes in the body, it can cause severe hair fall and also severe acne. If you're doing a laparoscopy, you will get the fibroid removed, okay, but what is the cause of this fibroid occurrence? That is the hormonal disruption. You need to correct it. So if you need to correct it properly from inside out, you need a medication which will work inside out, which will correct the fibroid, which will decrease the flow of the blood, and also which will give you immunity, and also which will help in not having a frequent recurrence. And that option can be considered as homeopathy. Homeopathic form of treatment. Why should you prefer homeopathy for this AOB or any sort of female problem rather than the conventional treatment or rather than allopathy? See, remember, allopathy targets the hormonal disruption by giving synthetic hormones, so there's no proper cure in it. So as soon as you stop this hormonal pills, there will again be hormonal imbalance. If there's a fibroid, they will remove the uterus. If you're not conceived, then that's not an option. Or if they're removing the fibroid, they're not removing or correcting the hormonal imbalance. If you are under hormonal imbalance and if you're using again hormonal pills, then that will completely disrupt for lifelong your hormones. So what should you prefer? You should prefer a system of medicine that will target everything, and that is homeopathy. So in homeopathy, we have no side effects. That is the primary thing. It's utterly safe to use. It's timely. So what do you mean by timely? See, many patients who come to us, first thing that they ask is, ma'am, I'm suffering from prolonged periods, and or I'm suffering from scanty or irregular periods, and I want a period to be correct. Remember, period is the symptom presenting because of a certain cause. It can be polyp, it can be fibroid, it can be any sort of endometriosis or bulky uterus or any other certain things. See, the cause needs to be addressed with a medication where it will decrease the size of the fibroid and also make your menstrual irregularity regular. So when we first give you medications, we are not going to hormonally correct it so that you will stop your period. It's wrong. So we are going to give you medications where your fibroid size or your bulky uterus thickness will start thinning out. As the time passes by, your menstrual irregularity also will be corrected. And also we have good number of cases where the success rate is really high. We tell the patient to stop thinking about the period primarily. First think about the internal damage that is there. That is, it can be fibroid, it can be polyp, it can be cyst, anything. First we need to decrease that, and along with decreasing, some people will experience regularity in the menses in the first month only. Some people will experience it in the third month, or some people in the fifth month. So the fibroid size will start decreasing from the first month, and after 6 months or 7 months of good amount of treatment, the size will decrease, the menses also will become regular. But if the fibroid size is really large, then it might take a longer period of time. But this is the best way to manage, as we are not giving any side effects to the medications. The hormonal imbalance is corrected, so is the cause of the hormonal imbalance. And we're going to give you medicine which is very individualistic in nature. See, if you're having fibroids, or if you're having PCOD, or if you're having any other female disorders, along with that you're having some acne, you're having hair fall, you're having certain other symptoms, breast tenderness, you need not go to different doctors for different symptoms. All of this will be taken into consideration, and a single drug will be given to you, or a single holistic medicine will be given to you, where it will help in curing the case internally, outside, and reoccurrences are very low in homeopathy compared to the allopathic form of treatment. What are the precautions you need to take care if you're having or if you're suffering from any of this menstrual irregularity? Remember that, see, any sort of menstrual irregularity. It can be scanty, it can be spotting, it can be prolonged period. It needs that certain medication, or it needs certain doctor consultation to know what is inside your body. So we need investigations for it. So regular checkups are very, very, very important. Second thing is managing stress. The cases of irregularity bleeding or irregularity in the bleeding is occurring because of a lot of stress that we're experiencing. So, what is the best way to manage stress? First is meditation. Do pranayamam, that is breathing in and breathing out to decrease the stress. Do yoga. If you're having a larger fibroid, larger polyp, or if you're having a thick, bulky uterus, do avoid cardio exercises. Rather, do yoga, stretching, or Pilates in the place of cardio exercises. Or if you're just experiencing, thyroid problems and you're having this uterine disorders, or if you're just experiencing a minor fibroid issue or a small cyst, you can continue with your workout regimen. But do not do cardio or intense workouts if you're having larger fibroids or larger polyps. Then maintaining a well-balanced diet. So what do you mean by well-balanced diet? I'm eating properly, I'm eating enough of protein and all of this stuff. Remember, there are certain things that you need to avoid, and there are certain things that you need to increase in the consumption. So what are the things that you should avoid? First thing is avoiding red meat, which is very, very, very important. Why should you avoid red meat? Red meat will cause estrogen abundance in the body, so that will cause prolonged bleeding. So what is red meat? Red meat is mutton, it can be lamb, it can be pork, it can be beef, or any other derivatives of this. Okay, you can prefer white meat like fish, or you can prefer chicken. If you're susceptible to chicken also, like even if the chicken is causing you certain sort of disturbances in the body, you can avoid that. But if you're not having any sort of peculiar disturbances after eating chicken, then you can continue with chicken. Avoid soy products because that can also contain phytoestrogens, which will cause disruption in the hormones. Increase the amount of nuts, increase the amount of seed intake, especially flax seeds, and also increase the amount of fruits which are rich in vitamin C, like kiwi, it can be orange, it can be your gooseberry, it can be your guava. Increase this, and also try eating healthier meals which contain a lot of leafy vegetables. Regular exercise, we already discussed about that, and monitoring your menstrual cycle. See, many people do not even know what was their last menstrual period, or when was it, at what date did they have, how much the bleeding was. See, we have to be conscious about our own menstrual bleeding so that we will know if there is any disruption in it. Mark your menstrual cycle in the calendar or in your phones for better better understanding of your own body. So what happens if you neglect this abnormal uterine bleeding? It can be anything: prolonged or scanty irregular bleeding. So you will experience anemia if you're having prolonged bleeding. You might think it's just like I'm having spotting, or I'm just having very small amount of blood every day for the past 2 months or 3 months. Your blood count can certainly drop suddenly, and you might need blood transfusion if you're not checking your blood count. So please do take care of it if you're having prolonged period. And impact on quality of life. If you're suffering from prolonged bleeding or irregular bleeding, you're always bloated, you have breast tenderness, you have other problems associated with it, like mood swings and all of that stuff. It does certainly impact the quality of your life and also disrupts the work-life balance. Potential for underlying issues. It might be a smaller symptom like just spotting, but it can have an internal certain problem associated with it. The cause of it might be very deep. So do get your doctor consultation as soon as possible. Infertility concerns. If you're suffering from abnormal uterine bleeding and you are not yet just married, or you're unmarried, or you're married and not just have conceived, if you're having these problems, do get a doctor consultation as soon as possible, as it on a longer run can lead into infertility issues. If you're watching this video and if you're suffering from abnormal uterine bleeding, so you can consult us through online or offline options, as we are having good success rate in treating these diseases. If you're staying nearby the nearest branch of Fidicus, you can come and contact us in person. If you're staying outside or you cannot reach us in person, you can contact us online either through audio call or through the video call. And also, after doctor consultation, you can share with us any sort of investigations that you've already gone through, and if we need any more, we will let you know. After all this doctor consultation, we will deliver the medicines to you, or the medicines will be sent through courier. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days, and across the globe, it can take 4 to 8 business days. If you're suffering from abnormal bleeding and you would like to get in touch with us, you can call us through this number. You can WhatsApp us, you can ping us or message us on this number. If you would like to know more about Fidicus Homeopathy, you can check this website www.fidicus.com. If you're suffering from uterine bleeding, if you're suffering from any sort of female complaints and you're looking for cure, why should you choose Fidicus Homeopathy? Remember, Fidicus Homeopathy stands for highest chance of health. Here we follow 3 principles. Primarily, the reason for doing this video is a high amount of success rate we are having in already treating the uterine bleeding, that is abnormal uterine bleeding cases. The transparent treatment here at Fidicus, that is, there is no gray area between the person and the doctor. We will be educating you on the prognosis of the case, the cause of the case, and everything. And also the personal care here at Fidicus. So what is the personal care that we give? If you're sort of having any sort of, dilemmas, myths about this condition of yours, we will educate you on that. So if you want to choose cure, choose Fidicus Homeopathy. Thank you.